Welcome everyone, welcome to my channel Medical Lectures and Mnemonics. So today I'm going to talk about a very important topic which is called a pediatric history taking. But before pediatric history taking, I'm going to discuss pediatric terminology which is very important in taking history. So first I'm going to define the pediatric. The pediatric is derived from two Greek words. One is the pious, which is mean child, and the iatros, which is mean the healer or doctor. So we can define a pediatric like it is the doctoring of children. Pediatric is one of the branch of medicine, so we can also define the pediatric like it is the disease, diagnosis, treatment, and prevention in children. So this is called pediatrics. It is the diagnosis, treatment, and prevention of disease in children. And one who got specialty in pediatric is called pediatrician, and the father of pediatric was Ibrahim Jacobi. So which baby will be considered child in Pakistan? Up to 15 year of baby or person it is considered as child. While in Pakistan the pediatric only treat, diagnose, and prevent disease in children whose age is less than 12 years of age. So there are some pediatric terminology which should know to each student. So the first is neonate or the neonatal age. The baby will consider neonate when his or her age is first month of life. When the baby the age from birth till first month of life is called a neonate. And the infant are those who from first month up to 1 year of life. And preschool children are those whose age is in between 1 and 5 years. And school child are those whose age is in between 5 and 15 years. And adolescent are those whose age is in between 12 and 18 years. And here you can see there is another terminology which is called a toddler. And those baby whose age is in between 2 and 4 years are considered as toddler. And teenager whose age is in between 13 and 19 years is called teenager. Here you can easily memorize the teenager age. There is T which is mean 13 and there is N which is mean 19. So those whose age are in between 13 and 19 are considered as teenager. And adult are those whose age is in between 20 and 39 years. So there are other pediatric terminology. Here you can see one is the gestational age. The age from the last menstrual period till birth is called gestational age, and it is 37 to 42. And postnatal age, the time since birth, and it is the age after birth is called a postnatal age. And premature neonates are those who born before 37 weeks of gestation. And full term are those who born in between 37 and 42 weeks of gestation. And post-term baby are those who born after 42 weeks of pregnancy. And SGA means smallpox gestational age. Those baby whose weight is less than normal than for the same gestational age is considered as SGA. So a male baby will consider SGA when his weight is less than 3 kg, and a female baby will consider SGA when her weight is less than 2.8 kg. So SGA means smallpox gestational age, and it will be guessed from two baby which have same gestational age. And LGA means large pox gestational age, who those baby whose weight is more than the same gestational age of other baby. So those are considered as large pox gestational age. And their weight is about more than 90 to 95% more than the baby of same gestational age. So this was all about the pediatric terminology. For more video, subscribe, like, and share.